guys, welcome back to the Pulling Curls podcast. Today on episode 36, we're talking about contractions. Not like isn't and can't and couldn't. We're talking about your uterus shoving a baby out. Let's untangle it. Welcome to the Pulling Curls podcast, where we untangle everything from pregnancy, parenting, home routines, even some family travel, because heavens knows our lives are tangled. I'm your host, Hillary Erickson. Okay, before we get started, I just want you to flip on over to the review section of whatever podcast app you're on, Stitcher, Apple Podcasts, and just leave a quick review. It means so much. It helps my podcast get seen by tons of other people so that they can understand what a contraction is too. This episode of the Pulling Curls podcast is sponsored by the online prenatal class for couples. It simplifies understanding labor so you can have a more relaxed pregnancy and birth taught by a highly experienced labor and delivery nurse, and can be done wherever you are, whenever you want. No more arranging busy schedules to fit in a prenatal class. Save 15% with the coupon code UNTANGLED. You can find out more at pullingcurls.com in the menu under courses or in this episode's show notes. Okay, so what is a contraction? It is exactly the same if you were deciding to lift weights and you decided to lift 200 pounds with your biceps and you were just straining at it. That is the same thing. Your uterus is just a big muscle and a baby incubator. It does both things really, really well. And so that's all it is meant to be. And as your uterus contracts, it is trying to shove your baby out, right? Because your body is done being pregnant. It knows that by around 40 weeks, that baby is going to get to be too big to come out of your pelvis. So it needs to get out now. So now that we understand what contractions are, what do contractions feel like? I remember being pregnant with my first and just kind of wondering, what is it going to be like when I go into labor? Like, what am I looking for? You know, the baby would move a lot and I would think, is that a contraction? You know, when I would stand up, my uterus would get very angry. Like when you stand up quickly, I bet a lot of my pregnant friends know what that feels like. Your uterus gets very angry. And is that a contraction? So yes and no. I mean, angry uterus is a little bit different than a contraction, but let's talk about it. So early contractions can be confusing. A lot of people feel like the baby is moving, and sometimes when the baby does have a lot of movement, your uterus will contract. Now, not every contraction feels painful. Sometimes it just feels tight, or I would even notice that my breathing felt a little bit different because the way your uterus is under your lungs, it kind of pushes up and you just feel like you're breathing differently. And so a lot of people don't complain of pain. They just feel like tight or different with a contraction. And that's okay. Just like when you're lifting weights, if you are just lifting a 1 pound weight, it's not going to be painful, right? But if you pull up the 200-pound weight, that's going to be painful. So that's kind of what to think of when you're starting out with contractions. Now, if you are having an induction where we are using misoprostol or Pitocin, that is going to change how contractions feel. That means we're kind of shoving you into labor versus early labor where you're at home, where you're like, oh, what was that? That feels different. And then you're going to kind of expand into it feeling like cramps. I know you've missed your period, but it is going to be back in full force at the beginning of your labor. You're going to have that lower back pain that's just kind of aching, but it's going to come and go. And you're going to be like, I feel fine. And then 2 minutes later, it really hurts. And then I feel fine. And that is a contraction. A lot of people think it's going to be a constant pain, and it isn't. Contraction's going to be like when you lift up the weight and then you put it down, you know, you don't hurt once you put it down. And so that's what a contraction is like. You also are going to feel like a lower pelvis pain. And sometimes people call it a fullness. It's kind of hard to explain, but if you've had period cramps, you know what I'm talking about. That's just what you're going to kind of feel at the beginning of labor. And then it's just going to progress from there, guys. They're going to get more painful. The contractions aren't just going to be in your back. They're going to start to wrap around your belly. Or if they were in your belly at the beginning, they're going to start to wrap around your back. You're going to feel your whole torso come into the contraction party. And that's what you're going to feel. I actually put on your TMI ears, skip ahead if you need to, but I think that labor is very similar to food poisoning. If you've had stomach pains like that where it gets really, really bad and then it kind of abates, right? And then it gets really, really bad. It is very similar to that as well. You do feel it in a different place because your uterus is not your intestines. It's a little bit lower, but if you're kind of like, what am I looking for? What is it going to be like? It's kind of like really bad food poisoning. But of course, instead of, what comes out with food poisoning is not nearly as cute or adorable as what you will have when you have your baby. And of course, it's not always just your uterus. Sometimes the rest of your body wants to get involved in this action too. You might end up having diarrhea or some nausea with it. And there are other parts of your body that kind of get in on the game as well. And we've talked about that in another podcast. I'll link to that in the show notes as well. What I think is really important is to talk with your doctor. Ask them about kind of what to watch for and how close the contraction should be before you head into the hospital. A lot of people ask me that question in my prenatal class, and it is a great question, but the problem is I don't know you. I don't know your situation. I don't always know what number of baby it is. I don't know how far away you live from the hospital. I don't know the traffic around the hospital. I don't know how far it is from like the parking garage to labor and delivery, because I have to say hospitals have like the worst parking ever. Although usually if you're in labor, you can just drop your car at the front door, come in, and then husband can take care of the car later. But talk with your doctor, find out what you should be watching for, especially for you if you have conditions like a placenta previa or a previous C-section. You need to know what to watch out for you. And so you ask your doctor questions. And if they aren't ready to answer your questions, then that's a problem. And I would definitely call them on it. Consider switching physicians. What I do want to say is it's very normal to wonder what contractions are going to feel like, what labor is going to feel like, which is why I have an online prenatal class for couples. I go into this tons and tons so that even your partner can know what to expect. You're going to know basically what to do when you think you're in labor. And I think people really enjoy that part, that I just simplify it. It's no longer this nebulous, what am I going to expect? What are things going to be like? Suddenly it's a little bit more concrete and easier to understand. So I think that's why people love that class so much. But if you're not ready to jump into that class, I actually have a hospital packing list. I never packed my bag ever until I was like in rip-roaring labor. I always was like, it's bad juju, because I went late with every baby. I knew I was going to go late. I might have packed it with my first. Honestly, I don't even remember. He's 19. It was so long ago. But at subsequent babies, I had gone late, so I didn't want to get my hopes up. A lot of people pack their bag at 36 weeks. If I had done that, I'm not sure those clothes would have even fit by the time I went to have my baby. My last baby was 12 days overdue. And so, yeah. Didn't want to pack the bag for her. So if you're looking to know what to put in your hospital bag so you're not racing around trying to grab all the things like you were, like I was when I was having my baby, definitely get that packing list. In that, I named the top 3 things that you need to let your partner know where they're going to be, because everyone wants them and then they glare at their partner when they can't find them. So be sure and check that out. Okay, guys, I hope you enjoyed today's episode. Everyone wonders what labor is going to be like. And honestly, even if you've already had a baby, I think you wonder, what is labor going to be like this time? Is it going to be fast? Or what am I going to be watching for? You do know basically what a contraction feels like, although some people go in and they have a C-section and they never know. So everybody's different. And just because your friend explained it one way doesn't mean that you're going to feel that same way either. So period cramps are the best thing I can say for comparison. If you like today's episode, I actually have a whole post on what contractions feel like. And I actually have a monitor that you can rent if you really want to know what a contraction is. It's not super expensive because it's a rental, and I'll link to that in the show notes as well. It's called the Bloom Life Monitor, and I have a coupon code, of course. Big thanks to our sponsor, the online prenatal class for couples. It simplifies birth, just like this podcast. If you want birth to be a little simpler, to understand it better, and to not be so nervous about what's going to happen in the hospital, be sure and check it out. Be sure and use coupon code UNTANGLED to save 15%. That is awesome as well. If you liked today's episode, we'd love it if you would share, subscribe, and review. It really makes a difference. We drop an episode every Monday, and until then, I hope you have a tangle-free day.